Thank you, Larry, for those very moving remarks. We appreciate it very much. We'd like to move on now to our patient and caregiver support part of our program, and I'd now like to introduce Linda O'Connor as our next speaker. Linda is a licensed clinical social worker with a Master of Social Work degree from the University of Southern California. She has worked as a clinical social worker for over 20 years with a focus on the emotional and social impact of medical diagnosis. Ms. O'Connor currently works as the coordinator for the American Parkinson's Disease Association Information and Referral Center at Cedars-Sinai Center, and is the social worker for the Movement Disorder Clinic in the Department of Neurology at Cedars-Sinai. Her work includes the facilitation of numerous support groups in the West LA area. And here's Linda. Okay. All righty.
Okay. Hello, everybody. Oops, let me move closer. Can you hear me? Yeah, okay. It's good to see everybody, and I'd like to thank CurePSP again so much for inviting me. I think that Larry set the stage for what we're really going to talk about this afternoon, both myself and the speakers that are following me, which is how you live with this disease, day by day. So it's important, of course, obviously, to be connected with a doctor, with a good treatment program. But aside from that, there's 1,000 other things, 1,000 other aspects that come into play as far as kind of getting through this. And that's what I'm going to focus on, and then this will just be built upon by the other speakers. So I'm going to pull out my notes here. I have a birthday coming at the end of this month, and I find that the older I get, the more I digress. So I'm going to try to stay centered here a bit. So this topic of coping emotionally, this is a topic I've spoken about quite a bit over the years to a lot of different groups. And probably even more so individually to patients and families that I've worked through the neurology clinic. So this is a huge, complex topic. But today I'm going to take a little bit different perspective on it by talking about how this quality of resilience really impacts, getting through this long term. So now I recognize that all of you here are probably in a different place with this disease process. Maybe some of you are newly diagnosed, maybe some diagnosed for quite some time. So some of the things that I'm going to talk about may be familiar to you. Some of the things I talk about may not apply to you much. But what my hope is that at the end of today, you'll be able to take away a little bit of something that maybe will be a new idea or maybe just a reminder of something to do more often. So, all right. So I like to always start by taking a look at first what are the actual challenges. So what is kind of this emotional landscape of living with diagnosis of atypical Parkinsonism? So I'm going to start by kind of going into some of the common kinds of challenges that I've seen in my practice, and then we'll get into strategies of how to work with it. So, all right. So I find that, regardless of the medical condition that people may be dealing with, and I've worked with people with a whole lot of different medical diagnoses, I find that there are some very common emotional reactions that people will have. But I've also found that there are some very specific emotional reactions that I think are tied directly to the disease process. And so I thought I would just touch on some of these. And again, this may be very familiar territory to a lot of you. So the first one being, and you've heard this several times, I think, and Larry just brought it up, is that this these groupings of diagnoses can be extremely difficult to diagnose. I've talked to people all the time, and Loretta, I'm sure, is going to touch on this. But I think going from doctor to doctor, not really knowing for sure, very often getting misdiagnosed as having Parkinson's, but then having it look very different, very frustrating. And I hear this quite a bit. A lot of anger, why couldn't they get it right the first time? And then this feeling of kind of being in limbo, which doesn't feel good, regardless of what you're dealing with. But just having this sense that it just doesn't feel quite right and that you may not have the full picture. And as many of you may know, you can be in this kind of limbo for years. So I think this has a very direct emotional impact that we don't see very often with other diagnoses. And then, of course, it's progressive. So there is grief involved with that. There's multiple losses that go along. So being able to deal with the sadness of that, and having to constantly make some changes as you go along. And I'm going to talk a little bit more about that. And then it's chronic. So people will live with this very often for many years. So you're having to look at, how am I going to accommodate this in my life? How am I going to adjust to it, not just in the first 6 months, but a year, 2 years, and beyond. And I think that brings some very special emotional challenges. So. Not well understood in the world. So atypical Parkinsonism, as you've heard, rare. So anytime you don't see anything a whole lot, that people are not going to fully get it. So people feel misunderstood, there's stigmatization to it, and this, makes a big impact, I think, sometimes as far as relationships and how people really talk about this in life. Depression, as well as anxiety, I don't want to leave that one out, but these mood problems can be part of the disease process itself, as well as just an emotional response to the change in life, to the losses. So for a lot of people, it's a double whammy. And you'll hear me talk about this a little bit, but I think it's something that really does need to be treated. Having a significant problem with mood, I think, can be just as big a problem as anything physical. And the mood problems also have physical consequences. So getting some effective treatment, Dr. Bordelon talked about some medications, but also counseling can be extremely effective. No cure yet. As you heard, thank goodness, there's some trials going on. There is hope. But I think this can lead to some feelings of hopelessness. I've been waiting for a cure for a while, and I wish they were making more headway. And that's a tough one. You share that frustration with people with a lot of different diagnoses. And then the treatment is not always effective, so it's variable. Some people will get some response with medications, other people not so much. This is often something I facilitate a lot of different Parkinson's support groups. So we'll often, the big topic is always, what medication are you on? And people will go around the room, and some folks, will say, well, I'm taking all this Parkinson medication, but I'm really not getting much result from it. And I always think to myself, well, you may not be dealing with your regular garden variety Parkinson's. But because of that, again, more frustration and some feelings of helplessness, so wanting some more effective treatments. So questions you may be asking, and again, these may look pretty familiar to a lot of you, but I thought it was helpful just to kind of, put it out there, because these are common things when I meet with people, either individually who have diagnosed or families. These are the common questions that I'm asked, or that people are asking aloud of themselves. So, and I wish, every time I talk with people, I wish I could give them some definite, concrete answers to these questions. And I think that's some of the difficulty, is that it's hard to know. Everybody has, as you all well know, a very different journey with all of this. But people like to know what to expect. This is a normal human kind of thing that we all want. We like a certain amount of certainty. We like to be able to plan, what's going to happen to me a month from now or 2 months from now. So the fact, I think, that we can't really give you a lot of that for sure can become difficult. So, all right, and then... So this is just to acknowledge, and you'll see with the next slide, that obviously this diagnosis affects families, friends. None of us lives in a bubble, so we interact with a whole variety of systems in our lives. So when one person is diagnosed, it's almost like the whole family, their other networks are diagnosed also, because everybody feels the impact, to one degree or another. So when I sit down with families, I often get a lot of questions that, as you'll see, probably no surprise, are very similar to a lot of the questions I get from the person themselves diagnosed. So, again, how can I plan for the future? What can I expect? What kind of help am I going to need? And how am I going to connect with all of that? So, and again, we can often provide some answers, some general ideas, but a lot of this, as many of you have found, tends to be you kind of figure it out as you go along. And I wish there was an easier way to do it, but I think with some guidance and with some support. So I was so happy to hear Larry emphasize that so much. I think this can get a little bit easier, but connecting is a big part of that. So, weathering the storm. So getting through all of this in one piece, or as I often say, getting through all of this and being able to preserve some pieces of yourself. How do you do that? So let me start by saying, there is no one right answer to this. I was just talking to somebody at lunch and I said, I wish I could give you the magic answer, but I can't. It has to be what works for you. And this is partly by your personality. This is partly by the people that surround you in life. But one of the big aspects, and this is what I'm going to really talk about a little more in depth, is this idea of resilience. So what is resilience? So the process of adapting well in the face of adversity, trauma, struggle. It involves the ability to confront adversity, but still find some hope and find some meaning in it. And I think that can be sometimes one of the most challenging pieces. And then having the capacity to bounce back. So this is to be confronted with something challenging, but then still be able to find some equilibrium, And now, resiliency, this is not something that you either have or don't have, okay? This is something that can be built, which is the good take-home message with all of this. So it doesn't have to be something that necessarily comes naturally to you. you can develop it. You can make it stronger. I like to feel that, no matter what your age, no matter what your life situation, no matter who you have in your life, it's possible to make things a little bit better and increase coping. So I think this is hopeful. I like to think that, we continue developing until the day we die. So I do not believe, and you can't teach old dogs new tricks. But there are definitely some factors that contribute to resilience. So the capacity to make some realistic plans and carry them out. So, and these factors we're looking at, these are kind of qualities that people who cope very well, who are very resilient, these are some of the things that they've been able to demonstrate. And this comes out of, some research here and there. Good self-esteem. So having confidence in yourself, feeling like you have the capacity to deal with this and get through it. Skills in communication and problem solving. So extremely important no matter what you're dealing with. But those folks who are able, to stay connected, who are able to address a problem head on. They've done some studies looking at, who gets through difficulties better. And they've definitely found that people who confront things head on. So I'm going to, take a look at the problem. I'm going to rally my resources, and I'm going to figure out what's going to work. Those folks tend to do better than folks who say, I'm just going to ignore this. I'm going to avoid it. I'm going to try to push it under the rug. I don't feel that I can handle it. Those folks, unfortunately, tend to struggle quite a bit more. So, and then the capacity to manage strong feelings and impulses. So this is basically being able to kind of manage how you emotionally react to things. So some people tend to be much more reactive than others. One struggle and it becomes this overwhelming kind of thing. Those folks tend to have a tougher time. So being able to sit with some difficult feelings, not running away from that, tends to be helpful in the bigger picture. And a lot of this study of resiliency, little bit has actually come out of the social work profession because the social work field has always taken what we call kind of a strengths perspective. So looking at, what works and being able to build on that. It also comes out of a field of study called positive psychology. Has anybody heard about this before? Yeah. Oh, there you go. Okay. Yeah. Dr. Seligman. So I forgot to mention, in the back, I do have a list of resources. So some of these are some support resources, but I also at the bottom of the page did list a couple of resources if you want to learn more about this whole area of resiliency, of positive psychology, strength-based perspective. So there's some websites. There's a very nice little booklet that I borrowed from liberally that's put out by the American Psychological Association, and the references is on that sheet in the back. So the good news, ways to build resiliency. So this is great. This means that skills can be learned. And everything I'm going to be touching on, this is certainly if you're a person diagnosed and family. I think that these skills are equally helpful. So people use them in a little different ways. So making connections. And many of you have often heard this before, but we say, I think this is the single most important thing, to get through, is to not be isolated. to really be connected, whether it's the people, in your life. So certainly maintaining relationships with the people who care about you. And then certainly asking for help. And this is a tough one. In my experience, I find that people tend to wait way too long to ask for help. We all like to be independent. There's the old, I'm going to just pull myself up with my bootstraps. I'm going to kind of suck it up and, hunker down. This tends to take its toll, and many of you may have already experienced this. So giving yourself permission, to get some extra help, and not just, the physical help, which is extremely important, the day-to-day, tasks, but also some emotional help. So this was also why I was so happy to hear Larry talk about the support groups. Because I think this is a fabulous way to get that emotional support. I think that there's something very special about being able to sit in a room with people where you don't have to explain yourself. You don't have to explain what is PSP, what is CBD. They already get it. It's a way to feel less isolated, to feel less alone with all of this. And I must say, I've spoken to a couple of Larry and Loretta's groups, and I always say they're a fabulous place to be able to gather a little bit of extra information, too. I mean, it's the people who are dealing with this, all of you, that I think tend to have the best ideas, and some of the very best resources, too. So you're experts in ways that you may not realize. So talking about feelings. So I think that keeping communication open. I always say, talking about the elephant in the room. So it's not unusual. I talk to a lot of families who will say, we get together, we have friends over, and, we talk about everything but the diagnosis and what's going on physically. Now, on the one hand, the person I spoke to at lunch brought this up. On the one hand, sometimes people will, in a very deliberate way, choose that. I want to have a get-together where we don't talk about my diagnosis. We can just be normal people talking about how your day was and, the movie you just saw. And I get that. But I think that there's also definitely a place for talking about the impact of the diagnosis, and really how you are feeling about it. Now, I think this can sometimes be particularly challenging for family members, because I've certainly talked to families or even friends too who will say, well, I have a lot of feelings about how this is affecting me, but I don't feel so comfortable all the time talking with, my loved one who's dealing with this, who's actually diagnosed. I don't want to make them feel bad. I don't want to, have them feel that there's some kind of a burden, and I get that too. So this is why, again, I think it's extremely important to have some people in your life that you trust, that you feel comfortable with, to really be able to openly talk about how you're feeling. And you obviously you decide who those people are going to be. But if you don't have anyone like that in your life right now, I would really encourage you to seek somebody out. And there's a variety of ways to do that. I mean, the support groups are a wonderful way to do that. Sometimes people make some wonderful connections online. But having a place, to vent a little bit, to get some of these feelings out. As many of you may have experienced, keeping too much inside, and tamping it down and holding it tight, eventually it leaks out. And sometimes it leaks out in a very big way. So better to vent it, gradually, day by day. Gathering information, this is why I'm always so happy, to see conferences like this. So I'm so glad that you finally got one here on the West Coast. So having a place, the CurePSP organization, You know, I've gone to their website. They have a fabulous amount of information on there. But having places where you can really get some very good, reliable information. For any of you that have probably been on the internet, you probably know there's a lot of funky stuff out there. So having some sources where you know it's going to be legitimate, where you can trust it, is extremely important. So, so thank goodness you have your own organization. And again, the support groups are a great way to get some of this good information. And then, of course, support group, as I've already mentioned several times. But then connecting with a variety of different kinds of services and resources out in the community. So this is an area that I often find people find pretty overwhelming. You know, there's a lot of needs that people may have, but they say, I just don't know what direction to go looking for it. And I also get the question, you know, I don't really know what I don't know, you know? So this is where I would really encourage you to seek out some people who really know the resources. So at the end, I'm going to give you my contact information. I certainly encourage you to use me for this. But, you know, certainly I'm sure the staff at CurePSP, the support group leaders have a whole variety of information. Loretta, who does the group here locally, has a whole resource directory that she and I have collaborated on. But I really encourage you to talk with someone. You know, very often, sometimes it might be a social worker at a local hospital or clinic, if they have that. If you haven't met anybody, ask for that. But just being able to sit down with someone and sort through. Because there is a lot of services out there. Now, I'm not going to say they meet every need in the perfect way. But I often find that people are surprised that there's more than they think there is. So connecting with that, you know, and I often say, you know, collect some of this information. You may not need it now. You may not ever need it. But I say file it away, you know, so at least then you have something at your fingertips. So if you need a transportation service, or you need to hire some extra help at home, or you need some particular type of equipment, whatever it might be, at least you've got something that you can go to. So better to use it before it becomes a crisis, you know, because it's never good having to scramble to look for this stuff. So making achievable goals and then being able to take action. So this is extremely helpful because I think, you know, when you're dealing with a diagnosis that, you know, they don't know exactly what causes it, there isn't a cure yet, you know, very often it seems to have come out of the blue. You can really feel a lot of loss of control. You know, I don't know what the future's bringing. So being able to have something in life that you can have a little bit of control over, you know, being able to make a goal, you know, and maybe it's something that you can look forward to. But I do say to make these goals small, you know, and realistic. But the benefit is you meet a goal, you're able to kind of check it off. It gives you a feeling of competence and that you've achieved something. And in this crazy world where everything, you know, seems that you don't have any impact on it, this is something you were able to do. You know, so maybe it's, you know, we're going to take a couple-hour trip and just go sit by the beach, you know, and that's going to be our goal for Saturday afternoon. And you do it. You know, so I think, you know, having something that propels you forward, you know, something that makes you feel like you've got some movement going in a good, positive way, helps people to be more resilient. So I think it also helps mood quite a bit too. Locate your strengths. So this is all about, you know, starting to first focus on what's working. I don't find that we talk about this as much as we really should. I think there is such a focus on pathology. You go into the doctor's office and it's, tell me the problems. Tell me, where you're having some difficulty. And that's important. I mean, they have to be able to adjust treatment, problem solve. But I think it's just as informative, to the doctor and to you too, to acknowledge and verbalize what is working. This is something that we don't have to worry about. This is something that we figured out. This is something that's not getting any worse. I mean, these are good things. So, and this definitely applies to coping. So this is looking at, how are you coping right now where it's effective for you? Are there ways that you've coped with challenges in the past that have worked for you? And are some of those ways of coping something that you can apply to this challenge? So maybe, you've coped in the past with difficult times by talking to somebody who's close to you. If that's worked for you in the past, certainly you can apply that to this too. Now, the trick with this is that some ways that you may have coped in the past, and this is certainly true for people who are diagnosed, but it can certainly apply to family too, it may be that because of your physical limitations, what your symptoms are, that maybe some forms of coping are no longer available to you in the same way. So let's say you always, coped with stressful times by hiking up the nearest mountain. That may not work for you now, but is there maybe an aspect of that you could adapt to have it still work for you? So maybe it's, I'm not going to hike up the mountain, but I'm going to go sit in my park for an hour. So having some flexibility with coping, some ways of kind of adjusting, really gives you more possibilities as far as, again, being resilient and coming through this. Expressing gratitude. So again, I think this is something we don't talk enough about, but I do know in a lot of the support groups that I facilitate, this comes up quite a bit. So people diagnosed as well as family members will say, I've found some gifts in this diagnosis. And they'll always preface it by saying, this is going to sound crazy, but I think that this is true. I think that there can be some gifts with it. So I've had people say that, since I've been diagnosed, I've found that I'm more appreciative, of what I have in my life. I value the moment a little bit more. I find that I'm a little kinder to other people. I'm a little less judgmental of other people. I've connected with some people in my life that I hadn't, had connection with for a while. So I think that there are things that can come out of this. So being able to recognize, again, what may be good. I had one guy the other day say, well, I'm grateful, every morning when I wake up and I actually wake up, So, I'm able to get out of bed. That's what I'm going to be grateful for. So I think, again, just acknowledging and having some awareness helps people, and certainly with mood. Accepting that change is part of living. I think this is a tough one. I think very often a lot of people I talk to don't work well with change. As human beings, we like things very often predictable. We kind of work in patterns. So when our world gets turned upside down, it's tough to adjust to that. But again, the people that tend to be the most resilient and get through are those people who will grieve that change or loss, but then look for some ways to adapt to it. Often people, I phrase it this way too, but finding a new normal. So now the challenge is that in the process, of disease, you're going to have to find a new normal probably many times. So you'll adjust, kind of get things going, and then there's a change. So, but people who keep evolving and changing with it tend to do better. Maintaining hope, and this could be a whole nother talk, but I think that there are a lot of reasons to be hopeful. And I think listening to what the doctors talked about this morning, the clinical trials, I think that, again, having CurePSP, who's raising money for research, I think there's reason to be hopeful. I mean, I think there's reason to permit yourself to be hopeful. And again, having a sense of hope definitely gets people through. Keeping things in perspective, not seeing every problem as insurmountable. So this is very commonly, I'll talk to people who, I say, awfulize things. So every challenge, every change becomes something that's just absolutely, positively, globally terrible. This is just not a good place to put yourself. I mean, it doesn't feel good, and it also does not show you where there may be a door out, where there may be another way to do this. So I often find in support groups, people will bring this up, and they'll almost always say, well, yes, I'm in a very tough situation, but I just talked to my cousin or somebody who's in an even worse situation. Now, you never want to hear that. But it does give some perspective that everyone is dealing with challenges, and sometimes even worse than what you are. And then utilizing your faith spirituality. So I know Loretta, who's next up, is going to focus on this quite a bit, so I'm not going to go into this a whole lot. But just to say that, people who are connected with something that feels larger than themselves, something that brings a sense of comfort, a sense of meaning to life, tend to do better. And like I say, I think it's great that Loretta is going to be talking about this topic right after me. Taking care of yourself. So this is a common thing, that if anyone's ever gone to any caregiver conference or group, you'll hear this, beat into you. Take care of yourself. Take care of yourself. I like to remind everybody that this goes for caregivers, family members, but also the person diagnosed. So I think sometimes there can be so much of a focus on, the disease itself and the treatment for that other, issues are neglected. I wish I could say that, any of the atypical, Parkinsonisms is all you're ever going to deal with. There's additional things that may come up in life, both good as well as challenging. I always say you can get similar levels of stress, from an illness, but you can also get a similar level of stress from a wedding, So you can get stress from good as well as bad stuff. And this stuff is going to come up. So having some ways that you take care of yourself, and by that I mean, taking a look at having a healthy diet, paying attention to how much sleep you're getting, paying attention to getting some distraction, being connected with other people, having some fun in amongst all of this, that becomes extremely important. And then the last thing, that humor works. So I think that you have to be able to bring a little bit of lightness, a little bit of, and this I think gives great perspective to what you're dealing with. Whenever this comes up quite a bit in the support groups I facilitate, people, it usually only takes one person, making a little bit of fun of themselves or talking about the humor in some difficult, frustrating situation. But that usually gets the ball rolling, So So I encourage you, to look for some of the lighter side in this, to look for some opportunities to laugh at some of this, to laugh at yourself. I always love sharing this one. You've probably all seen this at one time or another. Far side. The Institute for the Study of Emotional Stress. Researchers getting thrown out of the window. And the guy inside says, "Hey, I feel better already." So this is my contact information. I am at Cedars-Sinai Medical Center. I coordinate a information and referral center for Parkinson's. So that's part of my job. The other part is I'm a social worker in the outpatient neurology department. So I make myself available to all of you. I am in the office Monday through Friday all day long. So please feel free to call me, to email me. I share a huge variety of resources. I help people with problem solving, sorting through the vast variety of organizations and services, state programs, government programs, all of that stuff. I am more than happy to help with this. I've been doing this for a long time, so I've got files and files of information. So please take advantage of it. I often find I offer this all the time, and I just don't get that many calls. So use this as an opportunity to ask for help if you need it. And then I always like to acknowledge Dr. Tagliati, who's colleagues and friends with Dr. Bordelon, but he's our medical director that I work very closely with. So thank you so much for your attention. Again, thank you to CurePSP for inviting me. And I guess I'm going to be part of a panel at the end. So thanks so much.
Our next speaker is Loretta Mazara. Loretta is a nurse practitioner who received her master's degree in nursing from UCLA. She has many years of specialized experience in geriatrics and served as her